Your opinion matters, so let your voice be heard. Let's talk about nursing. Right here. Rapid Response with John. Hi there, everybody. Good morning. Kumusta po kayo? I'm back. Today is actually Sunday, and it's May 21st, 2023. Would you believe that? Parang kailan lang tayo nag-celebrate ng Valentine's? Parang kailan tayo nag-celebrate ng New Year, Christmas, May na, tapos next month, June na. Halfway of 2023, almost there. Anyway, hello to, bago ba ako mag-lecture, hello to Celeste Joy Subido, Karian, and Lala Maaga. They're watching. And hello to Pia Ali. Hi there. So as promised, I posted something a few weeks ago, and I said that I'll be doing stream every Sunday. So parang yung aking panata. Parang yung aking promise, no? So sige, mag-stream ako every Sunday. Magbibigay ako ng live lecture for the, for the NCLEX examination. This is actually helpful. This is not just helpful for if you're planning to take the NCLEX examination. It is also be a good help or great help if you're planning to take, any nursing qualifying examination. Maybe a qualifying examination in the Philippines. We call that your nurse licensure examination to NLE, or DHA in Dubai, or HAAD or Prometric somewhere in Middle East, or any nursing qualifying examination. So for today, we will cover physiologic changes during pregnancy. So tandaan, ito po yung mga normal na changes. Normal ba yun? Yes, yung mga normal na changes that you will encounter sa mga buntis. O, diba? So lumalabas ito sometimes sa examination that, syempre, as nurses, we should know what are the normal things going on, so that pag alam mo yung normal, you can easily figure out, pinpoint what's an abnormality. Remember, it's very important for us to know what's going on with our patient, because if you don't assess your patient well, what will happen? Wrong assessment, wrong intervention, correct? What will happen pag yung assessment mo, sasabihin mo yung doktor, mali pa yung sinabi mo sa doktor, panggalitan ka pa. Anyway, yun nga, alam mo to, gaya, naalala ko, the last time nag-stream ako, I was also doing the laundry. And guess what? I'm also doing the laundry today. So feeling ko, ito talaga yung magiging cycle ko. Ito yung magiging parang routine. While doing the laundry, you do live stream. Diba? Taray. Anyway, kumusta po kayo dyan sa Pilipinas? It's morning in the Philippines, and I guess it's Monday morning. Tama ba ako? Yeah, Monday morning in the Philippines. It's 6:18 in the morning, May 22nd in the Philippines. Naalala ko dati pag Monday, oh my God, papasok naman sa school. Anyway, speaking of school, hello pa lang sa mga kabatchmate ko dyan, Notre Dame of Marble University. Hello guys, kumusta? Kasi dati-rati nung sa panahon namin, all boys lang yun, hindi pa kami co-ed. Ngayon nag-co-ed na sila, tapos, tawag nito, nasa ibang nasa ibang location. So shout out to all my batchmates back in high school. And of course, sa mga classmates ko po sa college, hello, year 2000. Hello to my batchmates. Anyway, so, may mga antay dito. May mga pabate. Grabe. Hindi talaga siya hindi nagpatalo. Doon talaga nag-private message talaga. Sir John, shout out. Okay. Shout out to Almira Villalobos. Ayan. Almira Villalobos. O, ayan na. Na-shout out na kita. PM talaga. Okay lang yan. So, good thing guys, I'm free today. I'm free tomorrow. I'm back. May trabaho ako sa Tuesday. So, for this entire what do you call this contract, I'll be working night shift. So, and please, okay, just a heads up sa mga estudyante ko mamayang gabi. I have a review class tonight, 8 p.m. my time. So that will be May 21st, 8 p.m. Central Standard Time. I will meet you guys, okay? Hopefully, no, mabigay na sa inyo yung link ng Zoom ko mamayang gabi. Or before, 15 or 30 minutes before my class starts. Okay? And that will be 9 a.m. in the Philippines. Yeah, 9 a.m. Okay? So parang 13 hours yung difference. Ahead yung Pilipinas sa akin ng 13 hours. Anyway, who do we have here? like? Anong like na yan? Okay, ito pa sa ating isang monitor. Ay nako, Raymond. Hindi, sorry Raymond, hindi ko ma-discuss yung psych na yan kasi hindi naman ako psych lecturer. Sabi niya, can you discuss psych meds? Sorry, hindi ko ma-discuss yung psych meds. No, baka mali-mali yung sasabihin ko sa inyo. Mahirap na. Okay. So we'll talk about physiologic changes. So obviously, I haven't experienced this. Okay, I haven't. Oh, hello to Ma'am Ana Suico. Ana Suico is watching. Ana Suico, kasama ko yung clinical instructor sa San Pedro College. Anyway, shout out to all clinical instructors ng Bachelor of Science in Nursing Department ng San Pedro College, Davao City, and as well as clinical instructors, faculties of Respiratory Department. Hello sa mga teachers natin dyan. Hello, Ma'am Ansuy ko. Ma'am, uwi ako. Ngayong June. June 7. Uwi na June 7. Hello to Sheila GL. Hi, Sheila. Kumusta yung ating business? Uy, by the way, guys, if you wanna buy some legit at saka trusted po na tawag nito mga jewelries, you have to reach out to Sheila GL. She's the CEO, owner of J&J Jewelry. Okay, sabay tayo. Kailan ba uwi mo, Sheila? Ano ba? And okay, get well to your mom, okay? Yes, ma'am. Uwi ako. Hello to Bernardo Valle Jr. Hello, kumusta ka na? Same date sa'yo. Baka magkikita pa tayo sa aeroplano. Saan ka ba Saan ba yung mo? Saan ba yung first mo na airport? Saan yung una mong ang first stop mo? Same date. Sige, pag-usapan natin yan. Kasama ko yung lola ko. Anyway, hello to Bernardo. Kumusta ka na? Nasaan ka na ngayon? Ay, ano ko yan tawag nito? Miyembro ng kulto ko yan. Ito sabi ni Sheila, Tampa to Texas ata and Korea then Manila. Ooh. Naku, ang daming stops naman. Nasa Florida ka, di ba? Okay. From Tampa, Florida to Texas, then Texas to Korea, then Korea to Manila. Naku, dalawang stops? Mahal na kayo ticket ngayon. No? Last time na I checked, yung ticket umaabot ng almost $1,800. $1,800. Ay nako, ibili ko na lang ng item mo. Anyway guys, dami ko nga kuda dito. Lecture na nga tayo. Anyway, so sabi ko, actually few weeks ago I mentioned and I posted the different topics that I will be streaming in the next Sundays. Okay? Next Sundays. Sabi niya, saan rota mo? Minneapolis to Las Vegas. Tapos Las Vegas to LA. Then LA to Manila. Direct flight. Ano kaya? Parang hassle at saka haggard yung daming stops. Diba? Not unless kung may plano kang mag-shopping sa Korea or mamasyal muna sa Korea, then doon ka muna. Ang dami mo stops, kapal ka naman. Hindi, wala. Tawag nito, direct flight, LA. Ay, one stop lang pala, one stop. And that will be in LA. Kasi wala namang direct flight yung Las Vegas to Manila. So, either mag-Las Vegas ka to San Francisco, then San Francisco to Manila, or Las Vegas to LA, then LA to Manila. Isang stop lang. Ano ba yung airline mo? Ilang days ka, ilang weeks ka sa Pilipinas? O ingat ka dun ha. Balita ko pa naman na tumataas naman daw yung cases ng COVID. Siyempre. Gusto mo malaman ko nung airline ko? Ito yung airline ko. Sabihin ko sa'yo. Ano bang airline na Rica Fort here?
Mabuhay and welcome to Philippine Airlines.
Narinig mo? Yun. Korean airline. Kaya pala. Korean airline. Never pa ako nakasakay ng Korean airline. Mabuhay. Ulitin natin.
Mabuhay and welcome to Philippine Airlines. We care.
O, diba? Nakakaluyap, sarap pakinggan. Ay, pagkain nila, sarap pagkain nila. Sarap pakinggan. Ano ba mga pagkain nila? So, yun talaga yung rason bakit ka ng Korean Airlines sa pagkain. Ako naman kasi hindi ako pihikan sa pagkain kahit na ano pagkain kinakain ko. COVID, sabi ni Ma'am Ana, COVID. It's like seasonal flu na lang po. Oh, that's good. Pero I heard Ma'am Ana, tumataas naman daw yung COVID cases. So ingat po tayo. Still, you have to observe social distancing, hand washing, Sabi niya Sheila, you need to try to stop ibang airport naman. Next time. Stop tayo sa ibang airport, doon tayo sa Russia. Or doon kita yung stop mo sa tawag nito. Sabi ni Ma'am Ansoy ko, mask lang po. Okay. Mask. Oo nga, kailangan may dalang mask. Loyal ka naman sa PAL. Ay nako, kung alam mo lang uminit yung ulo ko sa PAL. Alam mo ba na almost 1 year ko hinintay yung refund ko sa kanila? Kasi 'di ba, dapat umuwi ako ng Pilipinas last year, August. Kinancel nila yung flight. Tapos minove nila sa different date. Sabi ko, I cannot do that kasi limited lang yung number of days ko na bakasyon. Tapos kung nung na-move nila, na-shorten yung stay ko sa Pilipinas. Sabi ko, I cannot take the flight. So yun, sabi niya, okay, i-refund daw nila. And take note, kailan na nabigay sa akin yung refund? Last month lang. Almost a year kong hinihintay yung refund na yun. Kung hindi mo pa sa kukulitin, kung hindi mo pa ipopost sa social media, they won't try to reach out. Oo, no? Kaya uminit din yung ulo ko sa PAL na yan. Ang problema, may mga friends ako na FA sa PAL. So, kailangan kong tangkilikin para may trabaho sila. Kahit minsan umiinit yung ulo ko sa services. Sabi ko, okay naman sana. Kaya lang, yung mga after sales na services nila, nakakainis lang. Here, sabi ni Astronomica nag-comment, Sir, any tips? Everything, nagre-review ako, super inaantok ako. Any tips? Ang tips, anong gusto mo? Tips na hindi ka antukin or tips na, tawag ito, para sa examination mo? So, tips para hindi ka antukin, tawag dito, mahirap yun, Ako nga, minsan nga pag nagle-lecture ako, natutulog ako pag nagle-lecture. Natutulog. Nakapikit ako pero nagle-lecture pa rin. Hindi, kidding aside, ang ginagawa ko, dapat matulog ka ng maaga. So you need to have adequate rest kasi pag hindi sakto yung tulog mo, your brain will not function well. Do you know that? Magkapi ka, sabi ni Sheila, magkapi ka. Grabe. O ba, astronomical, baka ayaw mong maniwala. Ito sabi ni Sheila. Ito. Papakita ko sa'yo. Ay, hindi clear. Kasi guys, tawag nito, minsan yung mata ko, pag ganun-ganun, kasi 3 yung monitors ko. Minsan hindi ko nababasa yung ibang comment. So sa mga nagko-comment dyan, nagpapa-shoutout, sorry, sometimes hindi ko nababasa. Okay, so anyway, uminom ka ng kape, importante yan. Sabi ni Ate Jenna, jumping jacks. nagbabasa ka ng nursing notes mo, tapos jumping jacks. Uminom ka ng kape. Prior to that, syempre matulog ka ng maaga. And then, yung review naman, yung tip ko sa review, go back to the basic. Okay? You focus ko na yung basic na mga concept. Huwag mo nang pahirapan yung sarili mo. Okay? Just remember, ano man yung dapat tandaan na sa nurse. Okay? Kasi yung qualifying examination, the main purpose of answering those questions, those qualifying examination, is to evaluate you on whether you know what you're doing as a nurse, whether you are a safe nurse or not. Ito sabi ng astronomical, I don't drink coffee pero lately nag-try na ako kaso parang useless. Ay nako, kurutin mo yung sarili mo. Ako rin hindi na ako umiinom ng kape ngayon. Siguro yung mga 20 years ago pag nagle-lecture ako, inom ako ng kape. Lalo na pag siesta time. Ito sabi ng astronomical, sumagot talaga, I have 12 hours of work kasi. Then pag uwi, busy sa baby. Oh, yun talaga Nasaan yung partner mo? Tell your partner na tawag kayo? Shifting kayong dalawa sa pag-alaga ng bata. Sabi ni Sheila, need ko mag-review ulit talaga. Ano na ba ngayon bago na talaga ang NCLEX? Umayos ka Sheila, pumasa ka na ng NCLEX. Anyway, mag-lecture na nga tayo. Dami ko mga chismis dito. So the main reason why I stream today or this afternoon or whatever, wherever you are today, this morning, this afternoon is to talk about physiologic changes during pregnancy. Okay? So take note, these are normal changes, normal things that you will see, you will encounter if you are pregnant. Sabi ni Sheila, iba na review ko gold. Uy, Ma'am She, love na love ko tong nabili ko sa'yo. Anyway, guys, bumili kayo kay Ma'am Sheila. Legit na seller yan Tsaka ang ganda ng mga items niya. Anyway, so I'll try to share my screen and then we'll talk about physiologic changes during pregnancy. Okay? And hello to Tina Baby. Loves you, sabi ni Tina Baby. Thanks for watching. Ano to? Oh, okay. Okay, guys, so let's talk about physiologic changes, okay? Physiologic changes during pregnancy. Parang feeling ko, to be honest, parang feel ko, yan yung pinaka-straight na line na na-drawing ko sa buong buhay ko ngayon. Sa buong buhay na pagle-lecture. Anyway, so we're talking about physiologic changes during pregnancy. Just a heads up, take note, these are not abnormalities, okay? So these are things expected if you are pregnant. Okay, so please be reminded, this will be very helpful if you're planning to take an NCLEX examination, okay, or any qualifying examination. You should know what are normal adaptation and normal changes if you get pregnant. Okay, so for us to easily understand these physiologic changes, physiologic changes. So what I'm going to do here is I will divide these changes per system. Okay? Ano yung mga changes natin sa respiratory, sa GI, sa cardiovascular, musculoskeletal, sa endocrine. So it will be easy for us to understand. Okay? So we will begin with what we call cardiovascular. Ano ba yung umpisa pala? Mali na yung aking pagsulat. Your cardiovascular. So when I say cardiovascular, I will also incorporate here your blood, your hematopoietic. Okay? Para isang discussion lang. Okay, remember, if you get pregnant, by the way, hello to Pia Bolivar. Hi, kumusta ka na? So these are physiologic changes. Number one, let's talk about the blood and cardiovascular changes. Now remember, if you get pregnant, okay, because of developing fetus inside the uterus increases its size. Correct? So may mga effect ba yon sa mga surrounding structures niya as the uterus increases its size? Yes, especially in your cardiovascular system. Why? Remember that when the uterus increases its size, there is always a risk that it will press or compress the structures surrounding it, especially on the posterior part of the uterus. Ibig sabihin yung nasa likod ng uterus. So nasa likod ng uterus is the inferior vena cava, which is one of the largest vein in the body. So if the uterus is here and the uterus increases its size, naiipit niya ang vena cava. Okay, so what is the implication when the vena cava is actually compressed? Then it will affect the blood going back to the heart. Okay, so it affects the preload, it affects the cardiac output. Okay, so ano mangyayari ganito? Remember that in your pregnancy, I said there is what we call uterine enlargement. Okay? Uterine enlargement. So what will happen if there's uterine enlargement? This uterine enlargement can cause inferior vena cava compression. Okay? Inferior vena cava compression. Okay, so naiipit niya ang inferior vena cava as the uterus increases its size. So what will happen once the inferior vena cava is compressed? Definitely it affects, okay, the blood flow, okay, back to the heart, causing what? Causing decrease in your venous return. Okay? So as venous return now is affected or decreased, definitely, okay natin dito. Okay? This will result to a decrease in the cardiac output. Okay, a decrease in the cardiac output. And what will happen if the cardiac output is actually low? That will also decrease blood flow to the placenta, okay, to the baby. There will also be decreased blood flow throughout the system. Kaya nga, a decrease in the cardiac output may result to decrease in the placental perfusion. And because of what we call decrease in the cardiac output, there is also a risk that the patient will develop supine hypotension. Okay, supine hypotension. Okay? Sir, bakit po? Remember, the moment you lie down, you lie on your back. Okay, you lie on your back, you're lying flat, supine. Because of an increasing size of the uterus, the more maiipit niya ang inferior vena cava. Okay? Pag naipit yung inferior vena cava, the more it decreases the cardiac output, decreased blood flow, venous return, causing hypotension. Kaya nga pag lumalabas sa examination ito because of supine hypotension, ang tinatanong dito sa NCLEX ay what will you do as a nurse? Am I right? So wag kalimutan because of this, okay, because of these conditions or concerns, okay, you let the patient assume a position na left side lying position. Left side lying position. Sir, why is this position helpful to your patient? This position is helpful for the reason that it relieves the compression in your vena cava. Okay? So once na-relieve yung compression sa vena cava, then that will improve venous return. Okay? So naalala ko dati, meron kaming estudyante ako that time. Anyway, big shout out to my clinical instructor sa DR. Hindi ko siya makalimutan, si Ma'am Aurea Shalito Bachar na nagkikita kami sa New York. Hello ma'am, kumusta ka na? She was my clinical instructor when this condition happened sa pasyente ko dati sa DR. Ako yung scrub nurse doon na mag-handle ng delivery. And then yung isang circulating nurse nagche-check ng vital signs ng pasyente, bumababa yung blood pressure ng mama habang nagle-labor. Tapos sinabi ng doktor sa akin, sinong nurse dito? Sabi ko, I'm the nurse doc. Sabi niya, okay. Sabi niya, itulak ko daw yung uterus, okay, ng mama sa side. Itutulak ko ng ganon. Tapos the doctor asked me, what is the condition of the patient? Sabi, syempre si Rica Fort biglang nagpalpitate. Sabi ko, oh my God. Sabi ko, tapos lahat sila nakatingin sa akin, yung clinical instructor ko nakatingin, yung mga kaklase ko na syempre kaklase ko nakatingin sa akin, yung RN nakatingin, yung midwife nakatingin, yung doktor nakatingin sa akin. Sabi ko, the patient is having hypotension. Sabi ko sa doktor niya, sabi ng doktor, yes. So why do you have to displace that? Why will you have to push the uterus of the patient? So, kinabahan ako, estudyante pa ako that time, aanga-anga. So, pinagalitan ako ng doktor. Tapos sabi ng doktor sa akin, that's your assignment. Sabi niya, that's your assignment. Sabi niya, are you back tomorrow? Sabi ko, yes. Niya, I'll be here tomorrow. Sabi niya, I will ask you again. Sabi. So, yun, pagkatapos nun, tawa ko ng tawa kasi hindi ko nasagot yung doktor. Pero nung pumunta ko ng library, tapos actually prior to that, tinanong ko yung CI ko, ma'am, anong reason ba? Sabi niya, that's your assignment, Mr. Ricafort. So yun, uminit yung ulo ko, pumunta ako ng library after ng shift. Nag-research ako, ito yun. Okay, so the reason why you have to do that, kung hindi siya maka-left side like i-displace mo ang uterus, okay, itutulak mo siya sa side to relieve the compression in the vena cava. Yun. Okay, another thing, because of a decrease in the venous return, okay, especially in the lower extremities. Remember, if you're pregnant, because of an increasing in the size of the uterus, it will also increase its weight. It will add pressure in the pelvic floor. Okay, parang feel na feel ko talaga, ano, na parang naranasan ko talaga, ano. It will increase the pressure and tension in the pelvic floor. As a result, okay, it will also decrease venous return because of the pressure, okay, because of the pressure brought about by increasing uterine size. As a result, okay, pag decrease ang venous return, pay attention sa lower extremities. Okay? Lower extremities. Okay? As a result, pag decrease ang venous return okay, from the lower extremities, yung pasyente natin, mga buntis, prone sa varicosities. Oh, kaya pala. Nagbabaricose sila. Yes. What else? Prone din sila sa tinatawag nating ankle edema. Okay, now I want to emphasize this in your examination. An ankle edema during pregnancy is normal. But if edema affects the upper extremities and face, that is already an abnormality. Okay, tandaan ha, yung edema sa mga buntis sa lower extremities expected. But if the edema or pagmamanas affects the hands of the patient and face, that is already an abnormality. That could be an indication of toxemia of pregnancy, PIH, or other underlying condition. Okay? Isa sa mga ginagamit sa NCLEX is that if a mother tells you, I can no longer wear my wedding band, or masikip na yung wedding band niya. So, ibig sabihin, lumalaki yung kanyang kamay. Lumalaki, there's edema formation. Okay? Ano sabi ni sabi ni Ate Jenna, happy na Zia, hapit na si Zia mga anak, murag need niya Kuya John diri. Ulag no? Oh my God. So congratulations in advance to my second cousin. Okay, and hello. Hi to Mark Jaran Alvarez. Uy, kumusta ka na? Hello to Charm Boyser and Monet Elona Pepito. Anyways, go back. So normal po yung pagmamanas sa mga buntis sa lower extremity, sa ankle. Sabi ko nga, pag yung pagmamanas niya affects the face and hands, that's not a good sign. Okay? Now what else? Because of the decreased venous return, yung mga pasyente natin, mga buntis pala, prone din sila sa DVT or deep vein thrombosis. Okay, so what is deep vein thrombosis? Deep vein thrombosis refers to clot formation okay, in the deep veins of your patient. Okay, saan ba yung common site ng DVT? In the lower pelvis or lower extremities. Kaya nga, hindi maganda na masahiin ang buntis, lalong-lalo na sa lower extremities. Bakit po? If you massage the lower extremities of a pregnant, okay, baka ma-dislodge yung clot. Once you dislodge the clot, we now call that as emboli. If that emboli enters the brain, it can cause stroke. If that emboli enters the heart, it may cause heart attack. If that emboli enters the lungs, it can cause pulmonary embolism. Isa yan sa mga rason kung bakit tumataas ang mortality ng mga buntis because of clot formation. So just a heads up, it's not good, it's not advisable to massage yung mga paa, lower extremities ng mga buntis because prone sila sa clot formation. Ibig sabihin, if you are pregnant, there is a condition called hypercoagulopathy or increased clot formation, which is actually a cause of DVT under Virchow's triad. Okay? So if you're nurses, okay, if you're listening to me, you know what Virchow's triad is. These are causes of your DVT. Okay? So again, so these are conditions okay, na ma-expect natin pag ang pasyente, babae, buntis. Okay? Next, another thing under cardiovascular is that okay, pag buntis ka, expected po that there will be an increase in the blood volume. Okay? Especially I am talking about your plasma. Okay, plasma. Therefore, if the plasma in the blood increases its level, it dilutes the blood more. So once the blood is more diluted, it causes anemia. So this type of anemia is not a true anemia or a deficiency anemia. This type of anemia is physiologic in nature. Kaya ang tawag natin dito ay physiologic anemia. So the cause of anemia here is not really due to a deficiency, but because of an increase in the plasma volume. So there is what we call physiologic anemia. Okay? Physiologic anemia. So, having said that, meron ba tayong pwedeng gawin dito? Meron po. Usually, yung mga doktor natin, yung mga OBGYN natin, nagbibigay sila ng mga supplement. Di ba? Napansin nyo, nung buntis ka, binigyan ka ng mga supplement. binigyan ka ng iron supplement, binigyan ka ng Anmam. Naalala ko dating first pregnancy ko. First pregnancy! Okay, anyway, physiologic anemia. Kaya nga, anong ginagawa natin dito? Okay, ginagawa natin dito, nagbibigay yung doktor ng iron supplement. Okay? Iron supplement. And of course, pag buntis ka, you need to modify your diet as well. So you have to eat foods rich in iron. So ano ba yung mga foods natin rich in iron? Siyempre, organ meat is rich in iron. Okay, what else? Green vegetables, green leafy vegetables rich in iron. And take note in your NCLEX, don't forget these fruits. Don't forget in NCLEX, ang nakalagay na saying natin na dapat tandaan ay, the darker the color of the skin of the fruit, the more iron it contains. Ano daw? The darker the color of the fruit, the more iron it contains. Okay? And I mentioned iron supplement. So huwag kalimutan sa examination, if your patient is receiving iron supplement, you need to pair that with a specific vitamin. Okay? And what is that? You need to pair that with vitamin C, or we also call vitamin C as ascorbic acid. Now, useless po ang mag-inom ng iron na walang vitamin C because your vitamin C enhances iron absorption. Okay? So, importante na pag umiinom ng iron, merong vitamin C na kasabay. Very good, Roxanne. Sabi niya, vitamin C. Anyway, hello to Roxanne Ruby Siason. Thanks for watching. So, anyway, so isa yan sa mga physiologic changes pag buntis ka. And of course, because of increase in the blood volume, that will also increase the workload of the heart. Kaya nga, pag increase ang workload ng heart, chances are, bibilis din po ang tibok ng puso. So take note, if you're pregnant, expected pala na tumataas ang heart, bumibilis yung ating heart rate. Usually mga 15% bumibilis po yung tibok ng puso, and that is expected. Okay? So this is the first system, okay, that is affected during pregnancy. Okay, let's proceed to the second system. So you have your first is your cardiovascular blood. Number 2 is your respiratory. Respiratory. Napansin niyo, sino bang nabuntis dito? Sino ba yung mga buntis dito ngayon? Napansin, or kung hindi, tapos nanganak na kayo, napansin yung buntis kayo, madali kayong hingalin. There is increased short of breath. Madali kayong hingalin, di ba? Sir, bakit? Kinakapos kayo ng hininga. Lalong-lalo na okay, on the second and third trimester. Because, do you know na pag lumalaki yung uterus natin, pag lumalaki yung uterus niyo because of the developing fetus inside, na-displace yung diaphragm. So, can you imagine this? Ito yung diaphragm natin, andito yung uterus. Hindi po sa magkadikit okay? So, andito yung uterus. When the uterus increases its size, okay? When the uterus increases its size, it displaces somehow the structures on top of it. Not only on top of it, surrounding the uterus. Pressure is also keep building up. That is why nag-elevate ang diaphragm about 4 centimeters. About 4 centimeters. So what will happen once the diaphragm is elevated? It will somehow restrict the movement of your lungs. Kaya nga, pag buntis ka, expected na magkakaroon namang episodes of shortness of breath. Okay? Why? This is actually related to diaphragm. Okay? Diaphragm elevation. Kaya pala. Sabi ni si Tel Christine Faith Adjavan, taray, true Jude sir, mag-sleep, magsandig na lang sahay. Char! Feel na feel ka talaga, oh my God. Okay? Now, take note, isa sa mga dapat tandaan sa examination, minsan lumalabas ito, sa select all that applies sa physiologic changes sa pregnancy, you need to understand the different lung capacities. Okay? May mga changes ba sa lung capacities pag buntis? Ano yung mga sinasabi mong lung capacities, sir, dyan? Yung mga tidal volume, expiratory reserve volume. And speaking of these volumes, na-discuss ko na to last night sa mga estudyante ko. So if you're my student and you're watching right now, okay? If you're watching right now, kasi sabi niyo manonood kayo at nagtanong kayo kagabi kung anong oras ako mag-live stream. Sabi ko, depende kung anong oras ako magising. Ito na yun. So depende po. Anong depende po? Normal po na may mga changes. Okay, so what I want you to remember for your examination, ano yung mga changes sa lung volumes natin? Kung may mga changes ba? Okay, so another thing to remember about respiratory here are the lung volumes. Or shall I say capacities? Okay? Huwag kalimutan na. Letter A, sa tinatawag nating functional residual capacity. Functional residual capacity. Or you call this as your FRC. Okay? Letter B, total lung capacity. You call this as your TLC. And letter C, we have your ERV or expiratory reserve volume. This is your ERV. Or by the way, sa mga kaklase ko pong respiratory therapist, hello, kumusta kayo? Nasa na kayo ngayon? Then we also have residual volume. You call this as the RV. And letter E, tidal volume. Ano ba yan? Ay. Anong problema mo? Tidal volume. And letter F is your minute ventilation. Okay, tandaan ha. So ano yung mga changes nila? Kung may mga changes ba o walang changes? Tingnan natin. Okay? Here, sa functional residual capacity, expected po na bababa. Okay? Total lang capacity, guess what? There's no change. Unchanged. Expiratory reserve volume, bababa. Why? Because, sabi nga natin, because naiipit siya because of the diaphragm elevation. Residual lang volume, bababa. Siyempre, expected yan. Yung tidal volume natin, tataas. Yung minute ventilation natin, tataas. Okay? So please do not forget these changes sa respiratory if you're pregnant. Okay? This is very helpful sa examination sa select all that apply. Okay? Changes sa mga buntis. Okay? Number 2. Next, number 3. Another system is your GIT. This is your gastrointestinal. May mga changes ba? Okay, sa buntis, pag sa GI niya, pagbuntis sila, naalala niyo pag pagbuntis ka, suka ka ng suka, di ba? Say, I felt nauseous. Mga ganon. Anyway, hello to MJ Kabatik Olivar. Hello to Marife Edkilang. And hello to Slier Soriano. I hope I said your name right. Anyway, sa GIT, kay expected po na ang mga buntis magkakaroon ng nausea and vomiting. Okay? Expected din po sa mga buntis na parati sila magkakaroon ng heartburn. Okay? Heartburns. Okay? Just a heads up. Yung nausea and vomiting, very common yan sa mga buntis, lalong-lalo na on the first trimester. This is all related to levels of your HCG or human chorionic gonadotropin. Okay? So tandaan nyo na, huwag kalimutan yung human chorionic gonadotropin kasi ibabalik ko yan mamaya. Okay, now, as a nurse, okay, kasi ito naman ang purpose natin, as a nurse, ano ang pwede nating magawa, ma-advise sa pasyente na buntis na nagkakaroon ng nausea, vomiting, and heartburn? Okay, so dito tayo, nursing action. Okay, that's the purpose of this video, right? So don't forget the abbreviation CEASE. CEASE. Okay? Ito yung pwede nating ma-advise sa pasyente pag may nausea, vomiting, and heartburn. S, tell your patient, tell the pregnant not to eat large meals. Dapat small, frequent feeding. That's letter S. Small, frequent feeding. Okay? E, ano niya, sir? Eat a lot? No. Advise your patient in the morning before arising to eat some what? Okay, consume some dry toast or crackers. This will help. Okay? What about letter A? Avoid gas-forming foods. Huwag niyong kalimutan to. Okay? Avoid gas forming foods. Okay? And S, of course, heartburn, nausea, vomiting. You don't want the patient to aspirate. Okay? S, sit upright. Sit upright, especially after meal, post-meal. Okay? So ito yung pwede nating mabigay na health teaching sa mga buntis, lalo na may mga nausea, vomiting, and heartburn. Not only nausea, vomiting, and heartburn na factor under GIT, you may also have constipation. Oh, napansin niyo ba nung buntis ka, constipated ka? Yes. So as a nurse, ano yung pwede nating maibigay na health teachings sa mga pasyenteng buntis na constipated? Okay, tell your patient to what? Increase fiber intake sa food. Your fiber will correct constipation. Okay? Next, what else? Tell your patient to increase what? Your oral fluid intake. Tell your patient to drink water. And guess what? Ambulation. So increase your what? Ambulation. Do you know that if you walk a lot, if you walk a lot, it increases your peristalsis? If you don't know what peristalsis is, the peristalsis, it's a wave-like motion in your intestine that will help propel the food. Okay? Ibig sabihin, it promotes gastric motility, intestinal motility. Yun po, nakakatulong yung ambulation. Kaya nga, if you notice, this one is not related to pregnancy. Kaya nga, if you had surgery, okay, kung may surgery ka, okay, nagta-transition yung diet mo. Right after surgery, NPO ka muna or nothing per orem, okay, hihintayin namin ng mga nurses, hihintayin ng doktor na you were able to pass flatus. Pag hindi ka pa nakautot, ibig sabihin, limited pa yung pwede mong makain, mainom. Okay? Ibig sabihin na if you're able to pass flatus, if you're able to pass gas, okay, if you farted, ibig sabihin there is already restoration of your GI activity. In order to do that, anong ginagawa namin nurses sa pasyente? Post-surgery ka, o bukas ng umaga, you dangle your feet first. Okay, then gradually, after that, you try to walk, make some baby steps. Then after that, let's try to ambulate. Sasabihin ng pasyente, ay, ayoko maglakad, masakit yung tahi ko. Anong gagawin mo? It's okay. I'll give you Tylenol. Can you follow? So dito papasok yung health teaching natin na you have to give analgesic to your patient before you let the patient ambulate. And you wait for about 30 minutes to an hour before the medicine kicks in, and then you let the patient ambulate para ma-tolerate niyo yung ambulation. Kasi minsan kasalanan din ng nurse, tinuro talaga yung nurse. Dito lumalabas yung ating health teachings. Okay? Now, sometimes yung mga pasyente ayaw nila because hindi nila naintindihan. So dito importante yung explanation. Dito importante yung health education. So dito papasok yung ating responsibilidad. Tell your patient to ambulate because that will do good to them. Okay, so ambulation will increase GI activity. Okay, so you say GI, gastric and intestinal activity. So it will make your GI again go back to its normal function. So isa sa mga indikasyon yan if the patient, okay, passes gas, okay, or there's bowel movement. So at least alam nyo bakit kayo kailangan maglakad after surgery. Okay? Not only ambulation, pag may surgery ka, lalo na pag general surgery, let the patient use incentives spirometer. Okay? Okay, bakit po? Using incentives spirometer will decrease the risk of lung complications after surgery. Anyway, that is a different topic. Let's focus tayo sa pregnancy. Okay, anyway, so let's proceed. So you have your constipation there. What else? Pag buntis ka, okay, under GI, isa sa mga physiologic changes, prone ka rin sa almoranas. Ay, ganun ba yun? Yes. So hemorrhoids. So bakit ba nagkakaroon ng hemorrhoids yung mga buntis? Okay? Bakit nagkakaroon ng hemorrhoids? Kasi nga sinabi ko, di ba, if you're pregnant, because of the developing or increasing size of the uterus, it adds pressure in the pelvic floor. So at the pelvic area. As a result, okay, what will happen is that it can cause dilation of the veins in the anal area. Okay? So magdadilate yung mga ugat sa anal area because of what we call pressure. Okay? So what will happen eventually, it can cause okay, dilation, swelling, leaving you hemorrhoids. Okay? So, ibig sabihin kung prone sa hemorrhoid, ano yung pwede natin gawin as a nurse? Okay? Ano yung mga dapat natin ano pwede natin ibigay sa kanila ng mga health instructions? Ito yung tinatawag ng CLSC. Ano yung CLSC? Ito yung mga dapat tandaan sa examination. C, of course, you have to correct constipation. Kasi nga, if you're constipated, you bear down. Once you bear down, the more it causes engorgement, dilation of the veins. Okay? L, to relieve the pressure, sabi ko kanina, because of the pressure in the pelvic area, to relieve the pressure, let the patient assume left side lying position. And one more, okay? Make it sure that the hips are elevated. Oh, hips are elevated with hips elevated. This is to relieve the pressure. Okay? Another letter S. Ano pang letter S natin dito? Sitz bath. Your sitz bath is a warm, okay? Warm sitz bath. Bakit warm sitz bath? It relieves the discomfort, okay, in the anal area. And of course, warm causes, okay, will promote circulation, okay? And if swollen ang area, you may do cold compression. Okay, cold compression, okay, for what reason? To relieve swelling. Okay, so don't forget this. So we're done with your cardiovascular, we're done with your respi, we're done with your GIT. Another system I want to emphasize, this is letter D. It's your endocrine. Okay? Ano kaya yung mga changes sa endocrine natin pag buntis? Okay? Ano yung changes sa endocrine pag buntis? Sa pagbuntis ka, there will be an increase in the activity of your APG. Increased APG activity. What is APG, Sir John? Anterior pituitary gland. This is your adeno hypophysis. Okay? So once there's increased anterior pituitary gland activity, maraming mga apektuhan ng mga hormones. Ano yung mangyayari, sir? An increase in the anterior pituitary gland activity can result to an increase in your TSH. Okay? Your TSH or thyroid stimulating hormone. This is a hormone that stimulates the thyroid gland. Okay? So it is a TSH, a hormone that stimulates your thyroid gland. So once thyroid gland is stimulated, marami siya mga possible effects. Ano yun, Sir John? Bibilis ang ating metabolism. Why? Because of the T3, T4. Increase in the metabolism. So anong implication yung pag mabilis ang metabolism natin? Bibilis ang tibok ng puso. Kaya nga, sabi ko kanina, expected na increase ang heart rate. Okay? Pag increase ang metabolism natin, it will also increase our calorie requirement. Kaya ibig sabihin, you have to modify your diet pag buntis. Kasi pag kumakain ka, hindi ka buntis, sarili mo nang pinapakain mo. Ngayon, pag buntis ka, you feed yourself and you feed the baby inside. So that will increase your calorie requirement because of increase in the metabolism. Next, because na-increase ang TSH, increase ang metabolism, you will have what? You will have diaphoresis. Hindi ba napansin, nung buntis ka, may heat intolerance ka, no? Madali kang pagpawisan. Am I right? Mainit. Expected yun. Okay, what else? Okay, you may also do have palpitations. Nagpapalpitate ka. Palpitation. All related to increase in the metabolism. And take note, since the stimulate ang thyroid gland, ma-overwork ang thyroid gland, expected po na slightly increase ang size ng thyroid gland. And what is the medical term in the increase in the size of thyroid gland? Goiter. So, as a result, you will have slight goiter. So, pwedeng lumaki ang ating thyroid gland, slight enlargement. Right? Now, what else? Because of an increase in the activity of your anterior pituitary gland, increase din po ang MSH. Ano yung MSH? This is your melanocyte stimulating hormone. It is a hormone that will stimulate your melanocytes. Melanocytes are cells responsible in producing pigment melanin. That melanin is responsible in giving color to our skin, color to our hair. Okay, you know? So pag increase ang MSH, this will result to increase in your melanin. Oh, di ba? So ano mangyayari ngayon kung increase ang melanin? Eh di magda-darken ka. So this will eventually cause hyperpigmentation. O, di ba? Okay, hyperpigmentation. And we also refer this as the mask of pregnancy. Di ba naalala niyo? Okay, pag buntis ka, umiitim yung kilikili mo. Pag buntis ka, umiitim yung singit. Pag buntis ka, umiitim yung pubic area. Pag buntis ka, umiitim yung ating nipo, yung ating areola. Okay? So the mask of pregnancy. And what do you call that? You call this your cloasma. So ibig sabihin, because of hyperpigmentation, there will be darkening of armpit, umiitim yung ating groin, ang ating pubic area, ang ating areola, there's darkening. Okay? And what else? Minsan, yung ating tiyan, may dark na line going down. Okay? Kung sa mga lalaki, we call it as happy trail. Happy trail. Okay, we call that, pagbuntis ka, we call that linya negra. Hyperpigmentation. Okay? And of course, minsan nagkakaroon ka ng mga hyperpigmentation sa stretch marks mo. So you call that as your striae, what? Striae gravidarum. When you say striae, these are stretch. Okay? Mga stretch marks. Striae gravidarum. Sa mga buntis. Okay? And of course, another thing, because of increase in the anterior posterior, bakit ko sinasabi yung posterior? Anterior pituitary gland, okay, anterior pituitary gland, there will also be an increase in your ACTH, your adrenocorticotropic hormone. And this is a hormone that will stimulate the adrenal gland, okay? So pay attention with the part of the adrenal gland greatly affected here, and that is your adrenal cortex. So ano mangyayari ngayon kung ang pasyente natin buntis because of adrenal cortex stimulation? So pag stimulated yung cortex, the two important hormones you need to remember here are the cortisol and then you have your aldosterone. Remember, another name of cortisol is your glucocorticoid. Another name of your aldosterone is your mineralocorticoid. So what will happen? What will happen po if there is an increase in the cortisol? Pag tumataas yung cortisol level ng patient, tataas yung blood sugar level niya. So expect there is slight hyperglycemia. So there will be an elevation in the blood glucose. And guess what? Sometimes pag umiihi yung pasyente natin, may makikitang glucose sa urine. Okay? So patient may end up having mild glycosuria. Glycosuria means glucose in the urine, mild. Okay? Now what else? Once aldosterone is there, I said it is a form of mineralocorticoid. It affects sodium. There is also water retention. So because of case aldosterone, expected po na ang patient natin magkakaroon ng increase in the blood volume. Okay? And expected din po na magkakaroon ka ng weight gain. Oh, kaya pala, no? Kaya pala importanteng tinitimbang natin yung buntis. Yes, kasi meron po tayong allotted na weight gain pag buntis. Depende po siya sa trimester. Okay? First trimester, second trimester, okay? May mga weight gain po tayo na allotted. Kaya importante tayo magpa-prenatal. Okay? So how often ba nagpapa-prenatal? Depende ko anong trimester. Kung first trimester, dapat nagpapa-prenatal ka how often? Okay, magpa-prenatal tayo sa pag first trimester, just the first, second, and third month. Fourth, fifth, sixth month, that is your second trimester. Am I right? So, ano to? Hello to MJ Kabatik Olivar. Hello din po, Sir John. Glad to watch your super helpful videos again. God bless you 100 folds. Anong sabi ni Roxanne Ruby Siason? Ano yung 112? What do you mean 112, Roxanne? So pag first trimester, dapat ka magpa-prenatal once a month. Okay, once a month. Pag second trimester, dapat ka magpa-prenatal twice a month. Okay? Pag third trimester, dapat ka magpa-prenatal every week. Di ba? But syempre, if there are also changes or any untowards na mga nafe-feeling, mga unusual na mga, if the patient is feeling some discomfort or anything unusual, huwag mo nang hintayin yung next week pa. You know what I mean? Okay? So anyway, that's your ACTH. Okay? And of course, hindi lang po increase ang anterior pituitary gland activity under endocrine. Okay? There will also be an increase in your HCG. Okay? Your human chorionic gonadotropin, which is very common on the first trimester. Okay? Now, wag kalimutan to sa NCLEX ha. On the first trimester, expected po na tumataas ang human chorionic gonadotropin, your HCG. And by the way, yung HCG, ito po yung ginagamit natin to check whether you're pregnant or not. Remember kung nagpapapregnancy test ka, kuha ka ng urine, di ba? You check for the presence of HCG. So take note, sabi ko nga, your HCG is responsible for making you feel nauseous and if you have nausea vomiting on the first trimester. Now, that is why, pag ang HCG ay expected na tumataas sa first trimester, kaakibat ng nausea and vomiting as well. So just watch out for excessive nausea, vomiting, and that can result to metabolic alkalosis because of hyperemesis gravitarum. Okay, now what else? Sabi ko yung HCG elevated on the first try. What if, Sir John, on the second trimester, your human chorionic gonadotropin is still elevated? So don't forget this in your examination. Pag tumataas pa rin ang HCG sa second trimester, doctors may suspect a condition called H-mole. Okay, H-mole. If on the second trimester, mataas pa rin yung HCG level. And kaakibat nun, increase ang kanyang abdominal girth, ang kanyang size ng abdomen in relation sa normal size during pregnancy, wala kang naririnig na fetal heart tone, most likely this is your H-mole. Okay? Isa sa mga management ng H-mole is you do DNC, that's dilatation and curettage. In short, RASPA. Okay? So tinatanggal. Dapat after DNC, bababa yung ating KHC. After DNC, dilatation and curettage, dapat bababa ang HCG level mo. In the event na mataas pa rin yung HCG level mo, after DNC, doctors again may suspect, I said it's not totally absolute. Doctors may doctors may suspect choriocarcinoma. Okay? Choriocarcinoma. Anyway, let's proceed. That's your HCG. And of course, another thing here is your placenta will also produce a hormone called, what do you call this? HPL. Human placental lactogen. Okay? Your human placental lactogen is a hormone produced during pregnancy, during the course of pregnancy. Okay? It's a placental hormone, produced by the placenta. The importance of your HPL or human placental lactogen is that it prepares the body of the mother for breastfeeding. It will also help nourish the child. Okay? How? Your HPL in nature is anti-insulin. Okay? It is an anti-insulin. Ibig sabihin, it will decrease the effect of your insulin. Remember, your insulin is a hormone produced by the pancreas that opens the cell wall in order for sugar carbohydrate to get inside the cell. So if your HPL is an anti-insulin, it prevents movement, crossing of your glucose from the blood to the cell. So kung anti-insulin siya, hindi makakapasok yung glucose papunta sa loob ng cell. There will be a lot of glucose in the bloodstream. So ang pasyente pala natin dito maging hyperglycemia, just like what I mentioned a while ago. Increase ang blood glucose. Yes. So how will it affect the baby? If there's a lot of glucose in the bloodstream, ibig sabihin there's a lot of food, a lot of glucose that can get inside the baby to nourish the developing fetus. Okay? So yan po yung effect ng HPL, human placental lactogen. Okay? So these are common changes you have to consider when you talk about endocrine. Okay? Now, hindi lang po endocrine, there are also other changes. Saan? Urinary. Okay? Letter E, urinary. Sir, ano kayo magiging changes sa urinary pag buntis ka? Merong dalawa, major. Ano yon? Pag buntis ka, increase ang risk mo, sa UTI. Okay? Next, Pag buntis ka, okay, there will also be increased urinary, okay, urinary frequency. So, ihi ka ng ihi. Hindi mo na po napansin? Sino mga buntis dito? Yung mga buntis kayo, ihi ka ng ihi. Lalong-lalo na sa first trimester and sa third trimester. Why? Remember, during first trimester, the first 3 months of pregnancy, the focus there is your organogenesis, formation of organs ng baby. Because of the importance of organogenesis stage, there must be sufficient blood supply in the pelvic area, in the uterus, to maintain that organogenesis, right? So having said that, because of increase in the blood supply, that will also increase your renal perfusion, causing increase in the GFR, glomerular filtration rate, causing increase in the urinary output. Okay, so ibig sabihin expected na ihi ka ng ihi sa first trimester. Eh bakit naman ihi ka ng ihi sa third trimester? Because when the uterus is developing, is increasing its size, maiipit niya ang bladder. So pag naipit niya yung bladder, didecrease ngayon ang capacity ng bladder kasi hindi na siya makapag-distend kasi naipit siya. So konting urine lang, iihi mo kaagad. Can you follow? So that's the reason why you have increased frequency. Okay? Next, letter F. Letter F. What about musculoskeletal? Musculoskeletal. Well, if you're pregnant, sabi ko nga, you will have increase in the calorie requirement. Same with your calcium requirement. So there will be an increase in your calcium requirement. Kaya importante po tayong magbigay ng calcium supplement sa mga buntis. Kung nagbibigay ka ng calcium, may kasamang vitamin yan. Anong vitamin yan? Vitamin yan. Ano yung vitamin ang kasama ng ibigay natin? So you have your vitamin D. Can you follow? Or you call vitamin D as your calciferol. Okay? Or call it calciferol. So importanteng magbigay ng vitamin D sa mga pasyenteng umiinom ng calcium supplement. Why? Gaya ng vitamin C sa iron, your vitamin D delta calciferol will enhance calcium absorption. Okay, what else? Pag buntis ka, can you imagine buntis ka, lumalaki yung tiyan natin, lumalaki yung uterus natin? Natin talaga. So pag lumalaki yung uterus natin, bumibigat siya, lumalaki, sometimes it will affect our balance and stability. That is why, anong gagawin mo to maintain your stance, to maintain your balance? You assume a lordotic position. So number 2, you will have lordosis. Ano yung lordosis? Nakaganyan ka, di ba? Pag naglakad ka. Okay, ganyan. Yung kuba naman, yung kuba na positioning posture that you're kyphotic. Pag ganyan ka, this is the pride of pregnancy. Okay, lordosis. Ngayon, pag lalabas siya sa examination, okay, kasi pag lordotic ka, because you just want to relieve the pressure and maintain your balance, eventually, it increases your what? Okay? Low back pain. Risk of having low back pain sa mga buntis. Okay? O ano kaya ang pwede natin gawin dito as a nurse? Anong pwede mga health teachings natin? Tell that mother to use what? Use a low-heeled shoes. Okay? And she may do pelvic rock exercise. Okay, ito yung pwede natin sabi. And of course, number 3, yung pagbuntis ka, the body is trying to prime yourself to deliver, to give birth. That is why there will be softening of pelvic joint. Bakit nagsasoften yung pelvic joint? In preparation for delivery. Okay, as a result, pag soft yung pelvic joint, it affects your gait. It causes what? Waddling gait. Okay, waddling gait. So as a result, okay, kung may waddling gait, anong dapat tandaan as a nurse? You have to clear the environment kung saan naglalakad yung mga buntis. Kasi nga, because of waddling gait, okay, you need to watch out for fall. Okay? Madali silang matumba. Ano ka ba? Okay? Hello to Dongsky. Hello, Dongs. Hi, Vince. Kumusta? Hello to Lala Maagad. Vince, punta ako dyan sa inyo. Okay? I would just cross the border. Si Vince po, friend ko yan, dating staff namin yan dati. One of the best, tawag nito, graphic artist. Ayan. So nasa Canada siya ngayon. And big shout out. Hello mo kay Baning. Okay, say hi to Vanessa. Anyway, okay, and the last, letter G, last, reproductive. O, di ba? Reproductive. Ano yung mga changes sa reproductive system ng babae pag buntis? Siyempre, malaking tipid. Hindi na siya bibili ng napkin. Hindi bibili ng tampon. Why? Wala siyang regla. O, di ba? Amenorrhea. Pag buntis ka at nagbi-bleeding ka, that's a red flag. Okay? Pag nag-bleeding ka, pag buntis, that's a red flag. Why? Pag first trimester may bleeding, it could be an indication of abortion, a pending abortion. Okay? Pag nagbuntis ka naman, mag-bleeding ka, pwede may be related to abruptio placenta or placenta previa. Am I right? So marami pong indikasyon, okay? Meaning, pag nagbi-bleed yung babae, depende kung anong trimester. First trimester, second trimester, third trimester. Okay? But anyway, pag ang pasyente po natin buntis, okay, aside sa amenorrhea, patient may develop Chadwick's sign. Chadwick's sign. She may also develop Goodell's sign. And she may also develop Hagar's sign. Feel na feel talaga, ano? Oh my God, may advertisement yung aking YouTube. Ewan ko sa'yo. So ano ba yung Chadwick sign? Your Chadwick sign refers to a purplish discoloration of the vagina. Aray. Purplish discoloration of the vagina. Okay? Goodell's sign refers to softening of the cervix. Hagar's sign also refers to softening of the uterus. Okay? So these are the different physiologic changes during pregnancy. So we're able to sum it up per system. Okay? So I hope this helps you guys. These are the different physiologic changes during pregnancy. Hello, ano dito? Sir, wala. Ano daw? Sir, wala pa Google non library? Ay, nako. Wala pang Google. Nako, kung alam mo lang, 1996. Pinagtawanan talaga ako ba? Wala pa daw Google that time. Ay, nako, 1996. Kailangan ko pumunta ng library. Okay? Naalala ko dati, favorite ko yung library, tambayan, at saka matulog. Tsaka yung librarian namin, pag maingay, meron siyang bell. Ting! Ibig sabihin, maingay kayo. So, kaya nga, at least pasalamat nga kayo ngayon, yung mga new generation. If you want to do some research, lahat ng pwede yung gawing research, nasa nasa tawag nito, nasa cellphone nyo na. Ay, sabi ni Lala Maagad, Sir, can you please bring back your board? Di ko po na screenshot, please. Inutusan ako. Saglit lang. Saglit lang. Where's that? Whiteboard. O, Lala, screenshot mo na. And 3, 2, 1. Ayan. Okay? Kaya kayo mga bagong generation ngayon, sabi ko nga, pasalamat kayo kasi nga, yung mga research nyo, Sir, ilang taon ka na, you look 30s. Oh, nako, astronomical. I am 43 years old. How I wish I am 30 plus. Welcome, Lala. No problem. So, astronomical, I've been conducting review classes, astronomical, for 23 years as well. So I'm doing this for quite a while. I used to be a clinical instructor, okay, sa nursing. And then after I finished nursing years, after that, I took up another course, Bachelor of Science in Respiratory Therapy. I've been doing this review classes for 22 years now. So I conduct classes for local examination and foreign qualifying examination for nurses. Anyway, so yun ano, pasalamat kayo no, lahat na pag may internet ka, may cellphone ka, pwede ka na mag-research. Dati-rati, ay naku, kailangan pumunta ng library. Tapos pag hinahanap mo yung libro na sasabi ng CI mo, you find this book, this is the textbook I'm using for the concept. Pagdating mo doon, wala na. Limited lang yung number of books. So ang gagawin mo, pa-photocopy ka na lang. Minsan nakakaloka pa na pa-photocopy ka, hindi mo man binabasa. Ang importante lang may kopya ka. Di ba ang sarap sa feeling na may copy ka, pero hindi mo binabasa. Anyway, hello to Rica Procala Bringuelo. Hi there. Thanks for watching. Anyway, guys, so that ends my class today. Sabi niya, sir, short explanation naman ng lung capacities. Okay. So may tinatawag tayong, mabilisan to. So may mga tinatawag tayong tidal volume, may tinatawag tayong residual volume, inspiratory reserve volume, expiratory reserve volume. Okay? So I'll talk about tidal volume. Okay? The normal tidal volume is about 500 ml. By the way, ito yung mga values na sasabihin ko. This is just an average values for adult. Iba din po yung values ng mga bata sa age bracket. So I'm talking about adult average values. Okay, the tidal volume is about 500 ml. So what is tidal volume? Tidal volume is the amount of air that enters and leaves the lung during normal breathing. So when you breathe in, when you breathe out, when you breathe in, you breathe out, normally that is your tidal volume, that is about 500 ml. Another is your residual volume. Residual volume is about 1,200 ml. So what is residual volume? The residual volume is the amount of air that stays inside the lungs to prevent collapse. Okay? Stays inside the lungs. Sabi ni Roxanne, hanapin ko lang logbook ko nung nag-review. Andun yung respiratory mo na teaching, sir. God bless, sir dyan. No problem. So yung mga naging estudyante ko, alam yung itong mga in-explain ko dito kasi din-discuss ko yung isa-isa sa review. Anyway, so yun nga, residual volume is 1,200 ml. It's the amount of air that stays inside the lungs to prevent collapse. Next is your IRV or your inspiratory reserve volume. IRV, it ranges from 3,000 to 3,300 ml. 3,000 to 3,300 ml. That's your inspiratory reserve volume. And what is this? This amount of air that can you forcibly inhale after your normal inhalation. Amount of air that you can forcibly inhale after a normal inhalation. The opposite of that is your ERV or expiratory reserve volume amounting from 1,000 to 1,200 ml. It's the amount of air that you can forcibly exhale, okay, after a normal exhalation. So ulitin ko, tidal volume is 500 ml, residual volume is 1,200 ml, inspiratory reserve volume is 3,300 ml, and expiratory reserve volume or ERV is your 1,000 to 1,200 ml. Okay, did I answer your question? Astronomical? Other question? Okay. Kung wala nang tanong, thank you so much, guys. Anong sabi dito? Saglit lang. Text. What is this? Welcome, Astronomical. Tina Baby loves you. Sabi, thank you. You inspire me. Oh, welcome. Saglit lang. My batchmate, Anna Marie, just texted me. Kumusta? Hoy, Makoy, kumusta ka na? Anyway, guys, thank you so much. If you have any questions or anything you want me to talk sa stream next Sunday, anong date ba yung next Sunday? Basta next Sunday, I'll do my stream again next Sunday. That will be on the 28th. Sabi ni Lala Maagad, nervous system assessment, Sir John. Yeah, sure, we can do that. Ano ba yung nervous system assessment? Yung mga Glasgow Coma Scale, yung mga ganon. Yung NIH stroke scale, yung cranial nerve assessment. Yeah, we can do that. So, October, May 28. Sige, yun ang maging topic natin. Gusto ko yung i-discuss. Okay, so on May 20, not October, on May 28, that's Sunday, okay, we will talk about neurologic assessment. Okay, yung mga Glasgow Coma Scale. Okay, you know, eye-opening, verbal response, motor response, tsaka yung NIH scoring system. Yung NIH, ito yung scoring system for stroke. Okay? Sunday dyan, Monday pala dito. Yes, Roxanne. Sunday sa akin, Monday sa Pilipinas. Astronomical. Sir, ano ABG basis po para mag-tip? Positive expiratory end pressure, ABG. Uy, halaka. Speaking of AG, parang meron akong nilagay na post about ABG. Parang yung, balikan ko nga yung post ko. Pang feeling ko yan yung i-discuss ko dapat next Sunday. Palitan na lang natin ng neuro, ha? Doon ko na lang i-discuss. Astronomical. Papalitan natin para ma-discuss natin. Okay? Okay? So, tapos na yung aking labada. Kanina pa sumasagot yung aking, kanina pa tumutuloy yung aking laundry machine. Tit, tit, tit. Tapos yung aking labada. So thank you so much, guys, for watching. If you reached this far, I hope you learned something. I'll see you again this coming Sunday, okay, where we will talk about some requested concept. So I'll see you next Sunday astronomical. Discuss ko yan sa inyo. And then sa mga estudyante ko, I'll see you tonight. We will have a continuation of your respiratory disturbances. Invite ko kay mamaya. Kasi mamayang gabi, magdi-discuss ako ng suctioning sa mga estudyante. Yun yung last na concept, suctioning at saka neuro din sa kanila. Paano ba yun? I don't know if I can let you join the class tonight. Anyway, I have a class tonight at 8 p.m. my time. That will be 9 a.m. in the Philippines. If you want to join my class tonight, please drop a message privately and then I can give you the link. Okay? So, passing ako kasi tapos na yung estudyante ko sa neuro. So, gusto na nilang magre-reinforce lang ako ng neuro na concept nila. So, ipapassing ko yung neuro nila, isa-summarize ko lahat. Okay? Penge, Zoom link. Sure. I-PM mo ako, astronomical, privately. Okay? Okay, guys. Thank you so much for staying. I hope you learned something. God bless everybody. Keep safe. Happy weekend. And I'll see you again this coming Sunday. Bye! Pa-join po, sabi. Sige po, just drop a message on me, okay? Sa Facebook. Okay? God bless everybody.